Hello learners, I am Professor Ruchika Kuba from School of Health Sciences, Indira Gandhi National Open University. We shall be talking about biomedical waste management today. Now what is waste? Waste is anything that is unwanted and needs to be discarded after the primary use. Waste in a healthcare setting covers a wide range of materials which can range from non-hazardous, hazardous, and these can also be infectious. Now WHO defines healthcare waste as the waste which is generated within healthcare facilities, research centers and laboratories related to healthcare procedures. In addition, it also includes some type of waste originating from minor and scattered sources, which will include waste produced in the process of healthcare undertaken at home. Examples of such processes could be home dialysis, self-administration of insulin and recuperative care. According to WHO, there are 6 categories of healthcare waste. These are sharps, infectious waste, pathological waste, pharmaceutical and cytotoxic waste, chemical waste and radioactive waste. India has taken out the biomedical waste management rules in 2016 and these have been later amended in 2018 and again in 2019. India defines the waste which is produced in healthcare facilities and during healthcare activities as biomedical waste. And according to these rules, biomedical waste is the waste generated during diagnosis, treatment and immunization of human beings, animals or research activities pertaining to or in the production and testing of biologicals or in various health camps, including categories mentioned in the Schedule 1 of Biomedical Waste Management Rules 2016 as amended, which have been notified under the Environment Protection Act 1986 by the Government of India. So, it is very important for you to understand here that the biomedical waste is basically the waste which is purely infectious waste which is generated in the healthcare facilities or during healthcare activities, as compared to the WHO healthcare waste. If you see here, we find that there are certain categories like the radioactive waste which are not included in the biomedical waste, which is coming under the biomedical waste management rules formulated by India. Now, why is segregation very important and what is segregation? Because under the biomedical waste management rules, the main important part of managing waste is segregation. It starts with segregation. Segregation means that different types of waste are kept separate in defined color coded waste groups or different containers. It is very important that the segregation should take place only at the point of generation and immediately after the generation of the waste. This is the most important step in the management of biomedical waste. Now, if you see this pie chart, you will find that out of the 100% waste, 85% of the waste generated in the health facilities is general or non-hazardous waste. 10% is infectious waste and 5% is chemical or radioactive waste. Both the infectious and the chemical or radioactive waste are hazardous healthcare waste because they can cause harm or infections in the human beings. Now, since the hazardous and infectious waste is only 10 to 15% of the total waste generated in the healthcare facilities, this waste can contaminate the entire 85% of the waste if no segregation is carried out. So, for example, if we have an infectious cotton swab and this is put in the big container containing general waste which may consist of just water bottles or office paper, kitchen waste, then the whole bin gets infected because the organisms from the cotton swab will infect the whole waste. So, it will be better that there is just one cotton swab, we can put it in a much smaller container separate from the huge amount of waste that is generated which is not infectious or not hazardous. Other advantages of segregation also includes that it will separate infectious and hazardous waste, which I have already explained. It will also separate recyclable waste from the hazardous waste. Now, there are a large number of infected waste. For example, we talked about plastic tubings in catheters, in IV tubes, these are all recyclable waste. We can put this infectious recyclable waste in a separate container as compared to other hazardous waste, for example various harmful chemicals and medicines. So, when we separate them, then the waste can be disinfected and recycled. This also ensures that the waste can be treated according to the treatment methods prescribed under Biomedical Waste Management Rules 2016. Now, I will tell you that when we talk about how the waste is segregated, you will find that there is one category of waste that needs to be incinerated. That is, it has to be burnt under high temperature, whereas another type of waste can be just autoclaved. So, we need to separate the waste according to the way it is going to be treated or managed. The advantage of segregation is that it will reduce the cost of transport, treatment and disposal, because as we saw that only 10 to 15% of the waste is actually infectious, and so we do not need to vigorously treat the whole waste. The 85% of the waste is municipal waste and it can just be going to some landfill without further treatment. This segregation will also improve the occupational safety and patient safety in the hospital, because we will try to keep the segregated infectious waste more carefully. We will transport it with greater care as compared to the general waste. This reduces the carbon footprint of the healthcare facility, because we try to also reduce waste and we also try to recycle the waste. Now, India has got color coding according to the Biomedical Waste Management Rules into different categories. The principle is that the waste groups with similar hazards are placed in one container or one group, and the segregation process, because of the different color codes, becomes very easy for even people who are not literate or low skilled workers, because they are the people who will actually be handling the waste. So, the waste handlers are able to quickly understand which color code, according to the color code, what is the category of waste, and accordingly they can manage it. Now, the yellow category, we have got 4 categories. The first category is the yellow category. As you can see, the yellow category waste is placed in the yellow colored bin, and the waste that comes under the yellow category is the animal and the human anatomical waste. It can be soiled waste, like you have the soiled cotton or you have the soiled bed sheets, soiled linen, then discarded or expired medicines, chemical waste, various chemicals that are used during the treatment, discarded linen, mattress, beddings contaminated with blood or body fluids, and pre-treated microbiology, biotechnology and other clinical laboratory waste. Then we come to the second category. This is the red category, the waste which are generated from disposable items such as the tubings, bottles, intravenous tubes, sets, catheters like urine bags, syringes without having needles, and fixed needle syringes, and vacutainers with their needles cut, and gloves. So, basically this is most of this waste, majority of this waste is plastic waste, and this is the waste which can be recycled. Coming to the third category is the white category, which is put in puncture proof containers, and this contains of all the sharps which are used in a hospital or a healthcare facility, like you have needles, syringes with fixed needles, needles from needle tip cutter or burners, scalpels, blades or other contaminated sharp objects that can cause punctures or cuts. We do not include any glass in this. Remember, it is all metallic sharps. This includes both discarded and contaminated metal sharps. We come to the last category or the fourth category, that is the blue category. This contains the glassware, broken or discarded and contaminated glass, including medicine vials and ampoules, except those which have been contaminated with cytotoxic waste. Cytotoxic waste is kept entirely separate, and anything contaminated with cytotoxic waste goes into a yellow container which has got marking of a cytotoxic symbol, and it is handed separately to the biomedical waste treatment facility. You also have the metallic body implants which are included in the blue category, and the blue category is placed in again blue puncture proof hard containers. Now, what was the need of legislation? Why was it important to bring in the biomedical waste management rules? Now, the impact of biomedical waste management was huge on the health and environment. There was a lot of risk of spread of infections like HIV, hepatitis B. There was risk of health hazards because of exposure to chemicals like mercury. Improper disposal could also generate harmful gases like furans and dioxins, and these are POPs which remain in the environment for a long duration of time and can have very harmful effects on health of all living organisms. Hence, it is important for environmentally sound biomedical waste management and to reduce the impact on health and environment. So, as I have already been talking about this, that the biomedical waste management rules were first notified on 28th March 2016 to provide a regulatory framework for management of biomedical waste generated in the country. There are certain waste to which the biomedical rules will not apply. So, it is very important for you to note this. For example, the radioactive waste which is covered by the Atomic Energy Act of 1962, the hazardous chemicals, the manufacture, store and import of the hazardous chemical rules of 1989, and now we also have the hazardous management rules of 2000. Then we have got the solid waste rules or the municipal waste management and handling rules 2000. We have the lead acid batteries which are managed by the batteries management and handling rules of 2001, and then the hazardous microorganisms and genetically engineered organisms and cells are covered under the cell rules of 1989. Rules generally will apply to all persons. It is not just the administrator of a healthcare facility or a health institution who is responsible to follow these rules or implement these rules, but all the people who generate, receive, collect, store, treat, transport, handle or dispose the biomedical waste are these are all the persons to which the rules apply. Now, which are the institutions which are covered under the biomedical rules? It is not just the hospital, nursing home, clinics and dispensaries, but it also includes veterinary institutions, animal houses, pathological laboratories, blood banks, Ayush hospital, clinical establishment, even the research or educational institutions, whatever health camps, medical or surgical camps and other blood donation or vaccination camps are undertaken, whatever waste is generated also is covered under the BMW rules. Similarly, the first aid rooms of schools, forensic laboratories and research labs also are covered under the ambit of BMW rules 2016. Now, whom does the responsibility of implementation of the rules lie with? The responsibility of implementing the rules lies with the occupier. And who is an occupier? An occupier is a person having administrative control over the institution and the premises which generate the biomedical waste. This could be a medical superintendent of a large hospital, it could be just the chief medical officer of a small institution like a primary health center, it could be a senior medical officer, it could also be the principal medical officer of a district hospital or a subdivisional hospital and a medical officer in charge of a sub-center or primary health center. There are a large number of responsibilities, roles and responsibilities of the healthcare facility institution head, and these involve implementation of the rules, training of the healthcare workers, monitoring and review of activities, legal compliance, submission of all the accident and annual reports, and also not the least ensuring occupational safety of its employees. Now, if you see this has been given even in the annexure F1 of schedule 1 of the BMW rules, and this basically shows how the implementation of the biomedical waste management rules takes place. So, first of all there is collection of the waste that takes place. This is followed by segregating the waste, processing it, transporting it, temporary storage, pre-treatment when required, and then proper disposal. Now, this is the treatment and disposal options of the various categories of waste that we have just now read. If you see, this is the options for the yellow category waste, and you saw that there are various subcategories of the yellow category waste. So, we have the human anatomical waste, the best treatment for whether it is human or animal anatomical waste is incineration or plasma pyrolysis. Where such facilities are not available, deep burial has to be resorted to. We have the soiled waste, in which incineration or plasma pyrolysis is again the best option, and in where these facilities are not available, then deep burial has to take place. When all these three facilities are not available, then autoclaving or microwaving followed by shredding or mutilation combined or a combination of sterilization and shredding may have to be resorted to, but this should only be taken care of or resorted to if you do not have the facilities of incineration or plasma pyrolysis. Then we come to discarded or expired medicines. Now the best option of this is actually to return the medicines to the manufacturer, so that they can collect all medicines and handle it at their end. But in case this is not possible, then the best thing is to incinerate it at a temperature of greater than 1200 degrees Celsius, or give it to the common biomedical treatment facility for storage and disposal for incineration at 1200 degrees centigrade. Encapsulation or plasma pyrolysis also takes place at the 12,000 centigrade. Then we come to chemical waste, disposal by incineration or plasma pyrolysis, but in such a case encapsulation in the hazardous waste treatment, storage and disposal facility can also take place. The chemical liquid waste, after resource recovery, the chemical waste is pre-treated before mixing with the other wastewater. Discarded linens, mattresses or beddings may be a large quantity, so we generally do a disinfection. This is generally done by non-chlorinated chemicals, and then they may be shredded, they may be broken into smaller pieces so that they can be easily stored and transported, and then we resort to incineration or plasma pyrolysis, and we also can take them up for energy recovery. In case such facility is not available, then we may have to combine with sterilization and shredding. We come to a major component of the big hospital waste, and this is the microbiology, biotechnology and other clinical laboratory waste, and so these need to be pre-treated to sterilize with the non-chlorinated chemicals on site as per WHO guidelines, and these then need to go in for incineration. And so what is important here is that we are stressing everywhere on non-chlorinated chemicals. It is very important for you to understand that if we do use chlorinated chemicals, what happens is that this whole material, when it is sent for incineration, the chlorine produces a lot of fumes, it produces dioxins and furans, which are persistent organic pollutants remaining in the environment for millions of years. We come to the other three categories. So for red, generally the best option is autoclaving or microwaving, otherwise hydroclaving can also be done. This is followed by shredding or mutilation or combination of sterilization and shredding, because these are the categories of waste that can be sent for recycling or energy recovery. And plastic waste should not be sent to landfill sites at all, because you know that plastics are non-biodegradable and they will remain again in the environment as a persistent pollutant. The white waste basically consists of the sharps, as you are aware. So autoclaving or dry heat sterilization followed by shredding or mutilation, and even encapsulation in metal container or in a cement concrete can be resorted to if we do not have the facilities of autoclaving or dry heat sterilization. Okay. Then they can be sent for final disposal to iron foundries, where again there can be some kind of a metal recycling, and metal extraction can be resorted to. The last type of category of waste is blue waste. This is disinfection by soaking the washed glass waste after cleaning with detergent and sodium hypochlorite treatment, or we can resort to autoclaving or microwaving or hydroclaving, and then we can send it for recycling. Now the second, the other activity of the related to biomedical waste management rules for a healthcare facility is monitoring and review of the activities. So the monitoring is carried out at various levels. At the beginning it is the state level, which is carried out the state monitoring cum advisory technical advisory committee who carries out this monitoring. At the district level, the monitoring is carried out by the district monitoring cum technical advisory committee. And for healthcare facilities having 30 or more beds, there should be a quality team or an infection control committee or a biomedical waste management committee, which will meet once in 6 months or in case there is an accident or an emergency, then they can meet more frequently. And those healthcare facilities which have less than 30 beds, they have a designated biomedical waste supervisor who monitors all the activities of biomedical waste management. In the Biomedical Waste Management Rules 2016, for the first time, legal actions have been enumerated for defaulters of healthcare functionaries who do not follow the biomedical waste management rules. So, for violation of the provisions or directions under section 5 of the Environment Protection Act is follows, that even we can go in for closure, prohibition or regulation of any operation or processes. There can be stoppage or regulation of electricity or water supply, closure of the healthcare facilities or common biomedical waste treatment facilities. For violation of the provisions liable of punishment under the section 15 of the Environment Protection Act includes imprisonment up to 5 years or fine up to 1 lakh. In case of violation continues, additional fine may extend to 5,000 rupees per day, and if the contravention continues beyond a period of 1 year, after the first day of contravention, then they can also be imprisonment. So, the punishments are quite harsh, and the government is very serious that all people should take management of biomedical waste very seriously and as per the laid down procedure. Now, a training of healthcare waste workers and others in the healthcare facilities is a mandatory requirement, as has been mentioned in the Biomedical Waste Management Rules 2016 under the section 4A, wherein it is the duty of every occupier to provide training of all the healthcare workers and others who have been involved in the handling of biomedical waste at the time of induction and at least once every year. And all the details of the training programs, the number of people trained and number of people who have not been trained, all this information must be provided in the annual report. Similarly, under the section 5E, it is for the duty of an operator. An operator is the person who is in charge or looking after the common biomedical waste treatment and disposal facility. It is also their duty to provide training of all their workers who are involved in handling of the biomedical waste, again at the time of induction and then once every year. Under the section 9 of the rules, the prescribed authority for the reinforcement of provision of these rules in the respect of healthcare establishment will include the hospitals, nursing homes, clinics, dispensary, all the institutions which we had enumerated and you had read, who have to follow these rules. So, they have to in addition to this, even the armed forces, the Ministry of Defence will be the director for the armed forces. It will be coming under the Director General of Armed Forces Medical Services, who will function under the supervision and control of Ministry of Defence. So, this is all that I wanted to give you an overview about the biomedical waste management. So, today you learned about what is waste, what are the various categories of waste as per WHO rules and as per the biomedical waste management rules in India, and how segregation is very important, especially for the biomedical waste, and what are the categories in which we can segregate this, why it is important to have the biomedical waste management rules, or why a legislation is very important in the country for regulating the management of biomedical waste, and what are the various provisions of the in the biomedical waste management rules which any healthcare facility or institution is required to follow. So, this is all that you learned today, and I hope that it has been very clear to you now. You must go back and read your course material so that you are able to relate with what you have learned in the video today.